afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us today is the Minister of Health, Shandro, as well as Dr. Deena Hinshaw, Chief Medical Officer of Health for the province, and Dr. Mark Joffe, Vice President and Medical Director with AHS. Minister Shandro will open up today's update.
Thanks, Tom, and thank you and good afternoon, everyone. I'm here today to give an update about contact tracing in Alberta. And as we've said from the beginning, contact tracing is an integral part of our COVID-19 strategy. So I want to take a moment to thank all of the case investigators and the contact tracers for their ongoing efforts. Now, a year ago, Alberta's contact tracers started with a team of just 50. Now their numbers have grown to 46 times that amount. The team is now more than 2,300 people, and they're working all over the province. Now, what that means is that there are now 41 contact tracers per 100,000 Albertans, and the team has made incredible gains. In January alone, case investigators and contact tracers from Alberta Health Services closed a total of 21,216 investigations. That's the highest monthly number of COVID-19 investigations closed to date. The tracers have been steadfast, and their dedication has brought us to the point now that they reach all positive cases within 24 hours of their test results. Now, since January 9th, we've been contacting and investigating all COVID-19 cases that we receive each day. And let me repeat that. Every case. On January 12th, the team contacted and traced 1,003 cases just in that 24-hour period alone. Now, together, our contact tracing team has the ability to investigate about 1,500 cases per day. And remember, the actual number of new daily cases recently is less than a third of that. So we've built up a big reserve of capacity, throughout the system as we continue to make sure that we are providing the resources that are needed in Alberta. Now, we don't expect necessarily that capacity to be there, but it's there. And we've met our current recruitment targets, but we continue to hire, we continue to train, and we continue to onboard staff to increase capacity even further. As Dr. Hinshaw has noted before, we have a dedicated team doing contact tracing for our schools. We're currently notifying all close contacts within 24 hours of receiving the list of close contacts from the school, which means a lot to me in particular. I have two kids who are ages 10 and 12, and so they're in the public school system in Calgary as well. And we're currently contacting school superintendents and administrators about COVID-19 cases considered infectious while in a school setting within 24 hours of AHS receiving information from a positive result. And we've also continued to refine the technology used in Alberta's contact tracing system, making changes in the AHS online assessment tool and booking tool. Now, the tool now allows Albertans to state which language is primarily spoken at home. So AHS contact tracers can have translators ready to go when contacting positive folks. There are also tools for people to tell us if they work in jobs where the spread of COVID-19 represents a higher risk, like in a healthcare setting or a childcare setting. And to date, the AHS online assessment and booking tool has been accessed more than 9 million times by Albertans. And AHS is also maintaining partnerships with businesses, with operators, with schools, with event organizers to collect and provide contact information for their staff, for their patrons, for their students if it's a school, in the event that information is needed for contact tracing purposes. Now, each one of these tools helps our contact tracers do their jobs and do those jobs as efficiently and as accurately as possible. The appearance and spread of COVID-19 variants in Alberta is worrisome. We know that these variants are more contagious and will spread more readily throughout our province. Now, globally, we've seen how variants can quickly become the dominant strain of COVID-19, infecting entire regions and even countries within weeks. And that's why there is now a team of 50 people, experienced AHS investigators who are dedicated solely to tracking variants in our province. Now, to date, this team has identified 239 cases of these variants of concern in our province. And I want to use this as an opportunity to assure the public that this team is well prepared and has the ability to quickly expand if it's needed. Between the expanded contact tracing team and technological innovations, specialized training, and putting lessons learned straight to work, we have a strong and effective contact tracing system. And I want to use this as an opportunity to thank all of the contact tracers and investigators for continuing their efforts, even when the work is tough. And not everyone welcomes a call from a contact tracer. They've had to deal with hang-ups, anger, even some abuse. And I want to remind Albertans that the tracers are people doing their jobs to keep everyone safe and to keep all Albertans healthy. Now, if you get a call from a contact tracer, remember that they can be trusted. So I ask you to please do your part and to understand that they're on the line to help you. They're on the line to help your fellow Albertans. And this isn't about blame. It's not invading anyone's privacy. It's about keeping you. It's about keeping those that you love the most, those in your community, safe and stopping the spread of the virus. Now, together, we're all working toward a future free of the need of burdensome COVID restrictions. And I want to take a moment to say how far we've come in the last few weeks. Our recent daily cases are below the Canadian average and are continuing to trend down. The strongest and most sustained downward trend of the 6 provinces outside of the Maritimes. We broke the trend, turned it straight down in the middle of winter, no less, right through the holiday season, weeks before vaccinations started to even have an effect in our province. And we asked people to protect each other and to protect the health system, and they're doing just that. Outbreaks in our hospitals are just one indicator, but a key one. And I recall back in November, there was a story that almost all of the hospitals in Calgary had outbreaks. The last report that we've received is that there has been only one now at this time. And overall, there are active outbreaks right now at only 8 hospitals across the province, including, as I said, 1 site in Calgary and another one in Edmonton as well. And that's due to the leadership of the infection control professionals in those hospitals and the work of all the staff to follow the precautions. But it's also due to all Albertans doing their part to bring cases down. We've made huge progress, and we've done that for one simple reason, because Albertans are doing the right thing. They're following the guidance from our public health officials, including Dr. Hinshaw, and the restrictions that have been put in place. They're taking responsibility for their choices, not out of fear of sanction, but because following the restrictions is the right thing to do. Now, we're still at risk, especially from the new variants. We have to continue to be careful, but Albertans have shown that they can do what it takes to bend the curve, and that's why I believe it's safe to move forward with our careful, staged reopening. There's more relief on the way, and as we get ready to move ahead with Freudian slip, I suppose. As we move ahead with vaccinations and as we look forward to the spring, this is the time of year when it always starts to seem like spring will never come here in Alberta, but it always does. It won't make COVID go away all by itself, but it will help. Until then, we need to stick at it. Please keep following the public health restrictions and do your best to help if a contact tracer does call you. And so thank you very much. I'll now invite Dr. Joffe to speak before Dr. Hinshaw provides today's COVID update. Thank you very much, Dr. Joffe.
Good afternoon, and thank you, Minister Shandro. I'm very pleased to be here this afternoon to share with you an update on Alberta Health Services contact tracing system and some of our successes thus far. Thank you, Minister Shandro, for highlighting just some of these, but I think it's worth highlighting some of them as well. As you know, throughout the fall and the early winter, we've been working extremely hard to expand our case investigation and contact tracing capacity. Thanks to these efforts, we are now seeing tremendous improvements. During the month of January, our case investigators closed more than 21,800 investigations. This is the highest number of investigations closed in 1 month. As Minister Shandro said, on January the 12th, the team closed a record high of 1,003 cases in 24 hours. Since the beginning of 2021, we've been contacting and investigating all COVID-19 cases that we receive each day, and we are reaching out to individuals within 24 hours of receiving confirmation of their positive test result. I'm very happy to say that we are in a much better place now compared to where we were at the end of 2020. And there are several reasons for this. First of all, and importantly, new cases have been trending down across the province over the last several weeks. I'd like to thank Albertans for abiding by the current public health orders. In recent weeks, we've seen that individuals with COVID-19 have had about 5 or 6 close contacts each. This compares with back in November, when the average was about 15 close contacts for each individual. Thank you to all Albertans for keeping your social bubbles small, and please keep doing so. This helps our team immensely. More importantly, with fewer contacts, we are able to identify and break the chains of transmission quickly, and fewer Albertans will suffer with COVID-19. Your role in preventing the spread of COVID-19 and your cooperation with our case investigators and our contact tracers has been paramount to the successes we've seen in recent weeks. Second is our aggressive recruitment efforts. Minister Shandro mentioned this. Our current workforce of approximately 2,300 case investigators and contact tracers is about 46 times larger than where we were at the beginning of this pandemic, with just 50 contact tracers. This includes recruitment of both regulated healthcare providers and non-regulated staff. With both professional groups involved in case investigation and contact tracing processes, we've been able to significantly accelerate the growth and increase the capacity of our team. Third has been our ability to adapt our contact tracing tools so that we can reach out to cases and their contacts as quickly as possible. Since the spring, negative COVID-19 test results have been available to Albertans by phone using an auto-dialer option. Test results through text messaging was added to our systems in the fall. Since mid-November, we've been using the online close contacts portal to identify and reach out to contacts by text or by phone. Since then, the tool has received nearly 97,000 submissions, 18,000 from Albertans, and the rest from the case investigators and contact tracers who also use the tool. We've also been sending out text messages to notify Albertans when their isolation period is over. Another innovation has has been crucial in the province's response to COVID-19, including contact tracing, is the COVID-19 online assessment tool. Last week, we added an additional function that Minister Shandro mentioned as well, and this is to include a new field for primary language spoken at home. This enables AHS to match an individual's preferred language with a case investigator who speaks that language. If that's not possible, we can make arrangements for an interpreter to be available up front. We also made changes to help identify certain groups more quickly for contact tracing, including daycare staff and those who are connected to an outbreak. To date, the online assessment tool has been accessed more than 9 million times by Albertans. These tools have drastically reduced the turnaround times to notify Albertans of their test results and have freed up our staff from having to make these notification calls. Our staff have been able to focus on the case investigation process instead, which includes reaching out to Albertans with COVID-19, identifying sources of infection, and breaking those transmission patterns. The fourth factor that has made it possible for us to keep up with case numbers is AHS's strong community partnerships. Since the first wave, we've been engaging businesses, operators, schools, sports, and event organizers to help collect and provide contact information for their staff, their patrons, and their students in the event that we need that information for contact tracing purposes. This has helped our teams a great deal and has sped up the process to identify and contact individuals who may have been exposed. Thank you to our partners for working with us. Again, I'd like to thank Albertans for the sacrifices that you've been making for almost a year now. We would not be able to celebrate these recent successes without your help. Thank you for all you're doing every single day to help stop the spread. Even with the emergence of new variants of concern in Alberta, our case investigation and contact tracing system is in a much better place now and going forward. AHS is well positioned to be able to meet the future demands for contact tracing in our province. We will get through this together. Thank you.
We will now turn it over to Dr. Hinshaw for today's COVID-19 update.
Thank you, Tom, and good afternoon, everyone. Before I begin today, I'd like to address a situation that has evolved with Grace Life Church. For months, Alberta Health Services has attempted to proactively work with this church through education and conversations to make sure that church leadership understood the health measures in place and the rationale behind them. These attempts to reach out and provide support and education were not successful in bringing the church into alignment with COVID-19 prevention requirements. And enforcement activities then escalated to fines and subsequent orders from AHS that the church follow COVID-19 protocols to protect their community. Ultimately, I understand that the RCMP decided to take the pastor into custody as a result of repeated violations of public health orders. The pastor was scheduled to be released, but I am told he did not confirm that he would comply with conditions of his release set by the court. The judicial process, including conditions for release, are determined by the courts. They are not determined by Alberta Health or Alberta Health Services. While this situation is unfortunate, I want to stress that this is a rare incident, and I want to thank the vast majority of faith leaders and faith communities who have worked hard to protect each other and their broader communities by following the measures that are in place. I know that the actions of one individual are not representative of all Albertans or all people of faith, who in particular have demonstrated the compassion and perseverance required to get through this difficult time. I also want to remind Albertans that throughout the pandemic, we have had some of the least restrictive measures in the country for faith-based gatherings. Currently, capacity for faith gatherings is restricted to 15% of the fire code occupancy. I am convening a town hall with faith leaders later this week to discuss these matters and to thank them for their leadership. This pandemic has gone on a long time, and I know that we are all frustrated and tired. It is essential, though, that we all keep following the legal rules that are in place. They are protecting our communities, our health system, and each other. Turning to today's update, we have now administered approximately 155,500 doses of vaccine in the province. More than 58,000 Albertans are now fully immunized with 2 doses. Over the last 24 hours, we have identified 415 new cases of COVID-19 and completed about 10,300 tests. Our positivity rate currently stands at about 4.2%. There are currently active alerts or outbreaks in 250 schools, or about 10% of the schools in the province. Currently, these schools have a combined total of 854 cases since January 11th. There are currently 362 people in hospital with COVID-19, including 55 in the ICU. Sadly, 7 new deaths were reported to Alberta Health in the last 24 hours. This leaves 7 more families grieving the loss of their loved ones, and my heart goes out to them. My sympathies go out as well to those families who have loved ones in the hospital or ICU, and those individuals who are struggling with their illness. To prevent future such cases, I also want to recognize the hard work and dedication of our contact tracing teams. This is complex and challenging work, and I want to thank them for their actions every day. I am also reiterating my message from yesterday, asking all Albertans to work with contact tracers if you test positive or if you've come in contact with someone who is infectious. I know it can be difficult sometimes to fully appreciate just how impactful and far-reaching each one of our individual actions can be. With every contact tracing call, we see the connections extend out like branches from a tree, from one person to their friends, their family, their co-workers, and so on. If you test positive for the virus and find yourself contemplating whether or not to work with contact tracers, please think for a moment about the repercussions of that decision. Put yourself in the shoes of your friend, co-worker, or neighbor. Maybe it's a neighbor who has a chronic health condition you're not aware of that puts him into a high-risk category. Perhaps it's your friend who works at a grocery store, shelter, or healthcare facility. Maybe it's a colleague who regularly cares for their elderly mother and may continue to do so because she doesn't know she is at risk. Whatever the situation, every close contact deserves to know if they have been exposed to the virus so they can protect those they love from any potential exposure. Thank you to all Albertans who are contributing to preventing the spread in so many different ways. Thank you, and we're happy to take questions.
All right, we'll go to the phone now. It's a very full queue, so we'll limit it to one question only, so as many journalists get the opportunity to ask a question as we can. Operator, could you put through the first caller, please?
Julia Wong, Global News.
Hi, this question is for Minister Shandro. What factors are you looking at to prioritize the vaccination list in regards to phase 2? Is it occupation, age, pre-existing conditions, and when specifically can Albertans expect to hear those details?
Well, I think Premier has announced that we expect to be able to make that announcement fairly soon. I think we've made sure that we've communicated to people that the principles of how these decisions are to be made are based on vulnerability, on equity, on making sure that we are looking at the evidence. These are going to be recommendations that will be going to the Cabinet COVID Committee that will be based on the evidence, that are considering the advice of the vaccination advisory committee that we have here in Alberta, as well as the National Advisory Committee on Immunizations. And we, as I said, the Premier, I think, made it clear that we were going to be making those announcements soon.
Operator, can you put through the next question, please?
Kevin Nimick, CTV.
Hi there, this is another question for the Minister. You didn't answer that question, so I'm going to ask it again. When specifically will we learn about the Phase 2 vaccination plan? And what are the factors you're looking at in terms of deciding on the order? Is it by age, by previous condition, by occupation?
Sure, Kevin. I'm happy to answer that question a second time. So we are going to be making that decision fairly soon. I think Premier made that very clear recently, so that announcement will be made soon. And it will be based on vulnerability, as well as based on the evidence and the recommendations that we've received from the advisory committee that we have here in Alberta, as well as the National Advisory Committee on Immunizations. Thanks, Kevin, for letting me repeat that again.
Operator, can you put through the next caller, please?
Harry Tate, Global Mail.
Hi, thanks for taking my question. First, Dr. Hinshaw, I'm wondering if you can update us on the positive case numbers at Allemel and the test numbers. And then for both the Minister and for Dr. Hinshaw, that outbreak started in November, escalated in January. I'm wondering why the response has taken so long, why it's taken so long to get people tested, taken so long to get people in who speak the languages of the employees at the plant and can help with cultural support. Why have we not learned from previous major outbreaks?
So the numbers we'll have to get back to you on. I don't have the specific numbers at my fingertips right now. And with respect to the second question, the numbers in the initial outbreak were very low, and those were maintained at a very low basis at a time when, you'll recall, our community transmission was at the highest level across the province. So the cases that occurred were not necessarily cases that were acquired at the plant, but simply were cases in workers at the plant. And the control efforts that were in place really relied on some of those basic and ongoing supports that are offered to all Albertans, whoever tests positive. As you heard from Dr. Joffe earlier, any individual who speaks a different language, whatever their workplace, they do have the opportunity to receive information in a language that they can understand best. And so some of those basic supports and basic information was provided throughout the response. With respect to the recent escalation of cases, of course, when that happened, then there was an intensification of the response that now is involving local community organizations, as there are now, of course, many additional cases, to make sure that again, that basic support that's been provided all the way along is now supplemented with the enhanced level, given the increased number of cases.
Operator, can you put through the next caller, please?
Elise Stolt, Edmonton Journal.
Hi, thank you. First, just a real quick clarification for Minister Shandro. Just to be clear, did you say that the decision on how to prioritize for Phase 2 has not yet gone to the Cabinet Committee? And then my question is for Dr. Hinshaw. It's on just a simple question on vaccine documentation. When my child got immunized, I got a handy little card with a date stamp and the name of each vaccine, and I think that's standard practice. So I was wondering what, if any, documentation people are getting when they receive the COVID-19 vaccine. Can you walk me through the rationale for that? And if someone needs proof of vaccination and hasn't gotten anything from Alberta Health, would they have to pay for a doctor's letter?
Dr. Hinshaw, do you want to answer the second part first, since it was pretty detailed?
Sure. So as you say, it is routine practice for anyone who receives a vaccine to have documentation of that, as it is a part of their standard medical record. And that will be true for COVID-19 vaccine, as it would be for any medication that anyone receives. There's always documentation of that. The My Health Record portal is available to all Albertans, and that will include their immunization record electronically, so it can be accessed and printed at any time. And at the time of immunization, there is a document that's also provided, as typically would happen with, for example, our influenza immunization campaign, where people are given a document that records the time, the date, and the particular lot number of the vaccine they received. And that documentation, as I said, also goes into the electronic record system.
Thanks, Dr. Hinshaw. And for the first question, look, we have developed recommendations to the Cabinet COVID Committee, and we hope to be able to make an announcement soon. That's all I'm going to be saying further on that today.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Chris Epp, CTV.
Thank you, Minister. I spoke to a couple councillors out in Wheatland County today, so east of Calgary, and this is not the whole council, but a few of them are really saying, they're advocating for people to break the rules, saying they're just not helping, that the harm is more than the good. One of the councillors himself said he had 30 people together for Christmas, and he goes for coffee with other people all the time, and there doesn't seem to be a drawback to that. Just what's your message to those communities that are either at their wits' end or simply choosing to defy the rules?
Well, my message is the same to all Albertans, that until we have vaccines, as Dr. Hinshaw has said many times, we are each other's vaccine. We all need to be following the public health restrictions for us to be able to protect not just ourselves, but those who are the most vulnerable around us, and that each one of us who ends up contracting COVID, there's a chance of us then transmitting further in the community, which could eventually lead to more cases and outbreaks in certain really vulnerable settings. So it's the same to all Albertans. And I'd say this, that, you know, I get the frustration that people have with the restrictions. We see it throughout the entire world. We're not alone here in Alberta. The entire world is going through similar restrictions. We have lighter restrictions in many respects than other jurisdictions, but people are still frustrated. They're anxious. They're stressed about the ways in which it impacts their social lives, their economic lives. But the fact is though that many Albertans are following these health restrictions. And because people are following it, that's why our numbers are coming down, because most Albertans, thankfully, are compliant. And to all those Albertans who are following the public health restrictions, thank you to all of you for being able to bring our numbers down and easing that pressure on our hospital system.
Operator, could you please put through our second last question?
James Keller, Globe and Mail.
Hi, Dr. Hinshaw. Back to the Red Deer meat plant outbreak. I know last week AHS sent the company a letter that recommended but didn't require all the workers to get tested after there was some indication that, you know, as much as 20% or more of the plant could be infected. I'm wondering why that wasn't mandatory. And again, just given that there were signs last week, I know that it started, you know, small in November, but last week there were signs there was a real problem. So why didn't AHS step in?
In all outbreaks, in every outbreak response that we have, we offer testing as a voluntary option for those who are not known to be close contacts or who are symptomatic or ill. Those individuals who are ill or who are close contacts are required to isolate or quarantine, but no one is required to go for a test. And that's something that has been a part of our response from the very beginning, that we recommend testing, we offer testing, and the pieces of our response that are mandatory, that are required, are, again, if somebody has been exposed to COVID or if they have symptoms that are compatible with COVID, then they are not allowed to be outside of an isolation or quarantine space, typically in their home. And so we followed that same protocol with the Olymel plant as we have for every single outbreak, which is to say strongly recommended testing, offered testing, but do not require that particular invasive procedure as it is something that those individuals can choose or not. And of course, then anyone who is in one of those risk categories, that's where there is not that option to be on the work site, where individuals would have to be at home isolating or in quarantine.
Operator, can you put through the final question, please?
Kirby Bourne, 630 Ched.
Thank you. Hi there. This is a question for Minister Shandro. I'm not sure whether Dr. Hinshaw will want to weigh in as well. But with news from the feds today that the vaccine schedule rollout has been accelerated, what specifically has Alberta done to be prepared to roll into phase 2 and beyond?
Well, the acceleration is the acceleration from the previous slowdown. So it's still not at the levels of what we were originally told, quite frankly. So we still have the capacity for, if you remember, the folks in phase 1B, about a quarter of a million people in phase 1B, and most of those, about 230,000 of them, were going to be our community seniors who are 75 years and older, and that was going to include family physicians and our pharmacies, and being able to provide that. And that's a big part of our ability to have that capacity. I also just want to just remind people that when it comes to the seasonal flu, we have the capacity to provide hundreds of thousands of vaccines in any given week here in Alberta. So the issue isn't for us to have the capacity as a province in being able to provide vaccines and provide them quickly. It's the changing amounts, it's the small amounts, it's the restrictions in supply that are the restriction on us getting vaccines to Albertans. Once we have a constant and steady supply of vaccines, we will be able to, through our pharmacies, through our family physicians, as well as through the public health nurses and AHS, be able to get out as many vaccines as we will be receiving in the coming days. But look, if there was any need for, if there was suddenly an approval for a vaccine candidate that is currently waiting for approval from Health Canada, and we receive an unforeseen amount, we do have, and we have built up through the last couple months, the ability for us to have that surge capacity as well. And in certain innovations, in having rapid flow through clinics is going to be one opportunity for us. If we ever do need that surge capacity, we will do that. But this really does come down to us not having the supply that would be needed to have the same amount of rollout that we could do for the seasonal flu vaccine.
Thank you all for joining us today. Dr. Hinshaw will provide another update tomorrow afternoon. Monday afternoon, apologies. Have a safe night.
Thanks, Tom.